Hello guys, welcome to the next episode of Let's Play Project Hospital. Let's jump into it. Smoothly in the next day, that was my last save, actually it's true. Um, we managed to survive the night, we made a ton of money in the morning, something like $21,000 or something, so it's pretty good. Um, there is one problem that we faced at exactly midnight. It said that somebody went home, hopefully. That counts as somebody who lost last day. The only reason I'm worried about it is because they actually, it's 0 here, it shows 0, but when I click on it, it still shows this person. Nancy Gonzalez got a simple Meniere's disease and she left. Now the reason is, and I found out, I just figured out myself, she was in the hospitalization area. In that time, if it's a different department, I cannot let the doctors control what they give her. Because what they're gonna do is simply try to send her to that hospitalization. And since we don't have hospitalization in, sorry for the screaming guys, we have a little 5-year-old here. Since you cannot send somebody to hospitalization in the, the internal medicine area, there is nothing you can do about it, and they just go home. So hopefully that was last night. I don't know. Let's see. I don't know why it was shown as a outpatient one. Probably because we let him go out from observation and then he just basically went home. Let's see if she comes back. I even put like ICU hospitalization. I don't think I need that. But she should get some diuretics, and she cannot get that because that's in another area. Let's actually put that here. Okay, I don't think that she's gonna come back. Oh, wait a minute, she's idle. Where is she? Wow, she came back. No, she didn't come back. What is going on? Originally it said left, but now it said idle. Oh, that's awesome. Let's see, okay? Nancy Gonzalez, I can find her here. Hopefully she's gonna come back. You see, it used to be left and now idle, so maybe she's coming back. She's not here yet, but maybe she's gonna show up. Anyway, let's not waste more time on her right now. Okay, let's just try to see a couple of things. First of all, we have 13 patients still in the hospital, 29 patients in the, in the clinic. Okay, we have about $19,000 right now, which is great. As you can see, in the morning, we got 21,000 coming in from hospitalization insurance. Just this morning, it's only 9:33. We already made 1,743 from medicine, and we already got a little from internal medicine. So it's actually not so bad. And let's actually go and check out. We have only 13 patients, so it's going to be quick. Let's quickly check them out. We're going to go like this and start here. We have only one. No. That's kind of weird. Why 2 patients here? One is Sarah Jackson. She is getting a fast. Is it the same? No. She's getting a fast, some sonography, whatever. She, like, right now it's hopeless. Like 12 pages of stuff. We already went through a lot of checking, but let's do that first. All right. No problem. Robert Anderson. Okay, so he went to TC hospitalization right now. I don't know why exactly. He is getting a CT and a stool analysis going, so we're just going to let him continue that. We don't need to do anything. Okay, so this person actually, we just send him over to the the general surgery department, because everything is basically general surgery unless he has this one, but it doesn't look like it. So we still have a ton of things that we don't know what his problem is. We haven't even done an interview apparently. That's kind of weird. Okay, how do you do barium swallow? Hold on. If you do a barium swallow, it's an X-ray room. Alright, you know what? Let's give him a barium swallow just in case. And we already checking. We already did a stool analysis. We checked. Did we check her pee as well? Not really necessary actually. I don't think so. So yeah, for now, we're just gonna do two exams on her. That's gonna be fine. And then we're gonna go up to the general surgery area. Well, look at that. We had a full hospital first, but now it's kind of empty. Jennifer Cole, okay. 7 pages already, and still nothing shows up. So this is why we already asked her to do all these kind of things. 1, 2, 3, 4, 5, 6 different things. She's gonna go through everything. She's not gonna be too happy about it, but whatever. I mean, her discomfort. Look at all the different tests that she does already. It's crazy. And we still don't know what her problem is. So, well, tough luck, I guess. But hopefully we're gonna figure out what's going on. Let's go for Carol Martin. He is scheduled for abdominal surgery. Let's see. Okay, wait. Only one abdominal surgery is scheduled, so that means that the other one is done already? Hold on. Carol Martin, that's the one. Dana Allen. She is actually in the general... Okay, they are doing the surgery on her. Awesome. I believe they are just getting ready. Right? Yeah, so she's getting a surgery already, so that's why she's not scheduled. She is doing it already. 9:33. That's good. All right, let's go back. So who else is in general surgery? So this person, these two are both general surgery, which is funny. Why aren't they in the HDU? I'm not sure. And this person is in the HDU room. Actually, not really necessarily, but I believe everything with him is done. So we just have to wait until he's good enough to go home. That's good. Cardiology, very quickly. Look at that. Nobody is in the normal cardiology room. Awesome. So we have a lot of space. We do have one here in the HDU. He came back actually from the ICU, so that's fine. Because he did have a septic shock before, so that's kind of dangerous. Hey. No, I can't. No, I can't. I don't know how to do it. Ask Mama to open it for you. Then ask Kaka to open it for you. So, Christopher Walker, let's see. He's already getting a thrombolytics. He's getting pretty much everything what he needs. Beta blockers. He already did the fast. Okay, so we're good. And we have another guy here, Thomas Miller, who is getting the IV antibiotics already. And again, it says that it has hidden symptoms, so basically we've done everything that we could do. Sunny, go to Mama, please. All right. And here we had the pathology. We don't have anybody, luckily, right there. All right, let's go to the neurology department. Look at that. Nobody's in HDU and only 3 people in 2 rooms. So we have a lot of space empty and hopefully... Okay, this guy doing microbial cultivation. We are waiting for that. Nothing we can do about it. This guy, we already know what's the problem. She's gonna still do an autometry. This is the one. Great. This is the one that was in the other department. and we couldn't do odometry there. So we already actually fixed her. She's already ready to go home. She doesn't need anything more. The only reason I sent her here was to do an odometry. Once it's done, if necessary, we're going to give her some treatment. If not, they're going to tell us like, okay, you can go home. So that's fine. And is it her? No, it's not her. And then we got this person here, Jordan Walker. He's going to do an MRI to decide which one of these two he has. That's good. And then we have the ICU department, where only one person in ICU. Awesome. And she actually doesn't really need ICU either. She's already all done. Well, she had twice heart failure, so I cannot really say that she doesn't need the ICU, but technically she's just being treated. Hopefully she's not going to die. Hopefully she's not going to collapse, and hopefully she's not going to die, but we cannot really guarantee that because obviously she already had heart failure twice, so they only release it from there when they are really sure that there is no issues. And then we go up one more floor here, and let's check if there is anybody here. No, that's just Sarah Jackson, who is getting the fast. That's fine, we don't need that. And nobody is in the hospitalization. Okay, and another thing we have to do quickly, we actually have to find out if anybody is waiting for the player, which is me. Yes, Patricia Cole is waiting for the player. Hold on, let's get rid of everybody else here. Patricia Cole is waiting for the player. That's one. Let's find all of them. Nobody here. Definitely no here. Not here. Wait a minute. The ICU. Wait. The ICU doesn't show that patient anymore. That's kind of weird. Hold on. Let's go to ICU and let's go back to the ICU room. Oh, okay. She's already transferred over to the okay, so our ICU is going to be all empty. She's just transferred over to the normal general surgery because she's already just being treated. Awesome. Okay, that makes sense. So let's go and let's see. Only one person waiting for the player. Here, nobody. Waiting for the player, nobody. Actually, only one person is not hospitalized. That's kind of weird. I don't remember having so many patients in there. Nobody. Waiting for the player, Judy Walker as well. Okay. Susan Cole, we don't need that. Okay. Nobody's waiting for the player here. Nobody's waiting for the player here. And here either. Okay, so let's just treat these two who are waiting for the player, and then we can actually go on. So Patricia Cole, you have an otitis externa. We already know that for sure. Is there anything we can do with you? Yeah, you might have edema. I can see this. So you need a physical. And you might need an odometry. You need to check your temperature. Actually, it's a lot of checking. And even some ear exam. Yeah. Here is the only problem. You're gonna do all of that, but not here. I'm sorry. You have to go over to this department, the internal medicine. And I don't think that I have anybody there, but that's fine. You just do that. And then the other one, Judy Walker, we can actually even close up on her. She's waiting for me? Why? She's already scheduled for everything, so no need for waiting for me, alright? Let's just go. Jessica Martinez she did the physical, so yeah, we know that this is your problem. Everything is fitting, and you are in the right department. You just basically treat her whichever way you want. You say that you don't need the recommendation. Yeah, I wouldn't give her either. All right. Go to here, athlete food. So physical actually turned out that it's enough to check. We don't need if you have fung. Well, you're gonna get the antifungal ointment anyway. So Dana Harris, it is our doctor, which is great. She's gonna give the antifungal. No need, no need. It's all low, so no need. We just give her the antifungal and it's good. Susan Robinson, she has influenza A, influenza B viral or sinusitis. Now, this is when it gets interesting because we need to know which one. I believe Elizabeth Hernandez can do differentials, so I think it should be all right. Let's do a physical nasal cavity. Let's do an oral cavity as well. Oral and nasal cavity. Let's do temperature test. No need because we already know that she has fever and she wouldn't have like a really high fever, so no need. Let's do a chest auscultation. And I think it should turn out which one. If not, we're gonna do a differential first. I think that should be just most neck palpation, maybe? No. I think we're good. Okay. Now, let's actually take a look. You know what? What I'm gonna do now, I'm actually gonna go up to the second floor, where, as you know, we do have a surgery going on. You take this away from here, so it's not covering anything. And we have a surgery going on. Oh, the surgery is not here. Hold on, let me actually take a look here. The surgery is not scheduled. The thing is that it's the same department, so it's going to be the same doctors, and we only have one set of doctors, so we don't have the option. Right now, this is where the surgery is going on. They they haven't actually started it, as you can see, but they already ready to do that. Is an abdominal surgery. Okay, so we're gonna just simply check his information. We're not gonna actually go there. Okay, radiation dermatitis. Okay, that has to be in traumatology. Okay, sorry, you have to go over. And let's see, we're gonna do a physical. Oh, we already did a physical, temperature and skin allergy. We did all of that. That's good. So really, all we need to do is just treat him. So that's it. There you go. Just go over and get ready. All right. Lisa Wilson found a P. aeruginosa, which is microbial cultivation, shows it needs antibiotic ointments. So that's what she had. You remember there were two possibilities. We don't know. So that's what you have. Fine. That means we're just gonna give you that, and we're just gonna give you basically. No, I'm gonna keep you here. So antibiotic ointment, and you're set. Jessica Foster, they are still not opening her body. She did the physical and it showed practically nothing. What can we do? We have a lot of things. There is like thorax percussion, temperature test. We can have an abdominal palpation. These are just simple stuffs that you can do right away without having to send him anywhere, so that's good. Physical, obviously, we did already. Neck palpation. That's what I thought. There you go. Because if she has nausea and vomiting and weight loss. So we just do all these. That should be enough for now. Is there a... We're not going to do a gastroscopy or barium swallow at this moment. I think this should be enough to just figure out which one is the sickness, and then we go further. All right, so that should be enough. Christopher Hall. Okay, she has infectious mononucleosis. Luckily, it's still in the internal department, not in the infectious disease department, because we don't have an infectious disease department. So, we're still gonna do like a physical, should we? A neck palpation would give him NSAIDs. We already have NSAIDs here. He would have rest if if he has an interview, but interview didn't give him that. Physical rest as well. So let's do a physical. Let's see if he needs some rest. Neck palpation would give him diet modifications, which he's not getting. Actually, look at that. The rest is already there because she has weakness. So I'm not even sure the physical even necessary. We don't want that. We don't need that. However, this is actually internal medicine. So again, I'm going to send this guy over to internal medicine. Let them do that. Physical and what else again? Do a neck palpation. The rest is okay because he's going to get the corticosteroids anyway. And he's already getting NSAIDs. So no worries for anything else. You just go over, sir. Now, she is asking for a scalpel, so finally they're gonna cut her up, I'm sorry. Hand bursitis. Okay, this is an orthopedia problem. Let's see, how many people are in orthopedia right now? Actually 3 people, but 2 of them are already treated. So you know what? You are going to go over to the orthopedia department. Okay. And let's see what else. Physical, temperature we checked. Alright, so all you do is basically give her whatever she needs over there. Frank Brown, okay, we know exactly what your problem is. You are in the right department. All you have to do is just treat him. Perfect. There you go, Lisa Wilson. Hospitalization is over. Not a lot of money, but as you can see, she did find out with the microbial cultivation that she needed some antibiotics. She got those. Everything is good. She can go home. Thank you. And giving us $540. Okay, so she's cut open already, as you can see. Kate Walker. Okay, it looks like either internal or infectious, which is most likely not. Possibly cardiology. So, I'm going to actually try to focus on eliminating the cardiology here. So what I'm going to do is I'm going to do a physical. It's a neck palpation. No, thorax percussion. Chest auscultation. And we should do a CRP. I'm not going to do these two. I'm going to check if she has elevated CRP. Because that's very quick. Okay? And then we see if she turns out, if it shows everything that we need. Fraser Thomas. Okay. Again, it's almost certainly general surgery, but not sure. He's got some abdominal pain and everything. So let's do fatigue, abdominal pain, weight loss. Physical. Let's do a speech listening, I believe. When somebody has what is it? Fatigue, I normally give him speech listening. However, I don't see it here, so I'm not sure that he needs. Let's do a chest auscultation. Let's do a temperature test. And what else? Something simple. I think for now that's gonna be enough. Okay. Linda Davis. Okay, she just simply have a chronic fatigue syndrome. We can deal with that easily, but let's see. We're gonna have If you do a physical, you're going to get some rest. If you do an oral cavity, you're going to get some possibly pain medicine. So let's do an oral cavity. Do you have some sore throat, basically, right? Yeah, sore throat, exactly. Let's see what else do you have. Physical would give him recommendations. You know what? Let's do a physical. I mean, for every single patient, I think a physical is kind of like a must. You cannot avoid that. Speech listening would be okay, but basically it wouldn't help you anything at all. Oh, maybe if you are depressed. So let's do a speech listening. And that's pretty much it. All right. And at the end of the day, you're just gonna get some recommendations. So whatever. Okay. Procedures have finished for a diagnosed patient. She is all done. Dana Harris, thank you for your good job. We're gonna send her over, send her home, and voila, we have 46 out of 60. We are in the last quarter, guys, so hopefully we can do something about that. David Jones, all the blood everywhere already. Look at that. These people are really messy. Okay, so he had interview and triage, and now she has chest pain, sweating, and fatigue. Okay, that's actually chest pain is kind of scary, but let's do a physical chest auscultation for sure. Temperature test. And should we do a CRP? The next step will be a CRP if it doesn't help us find out which one is the correct one. Okay, somebody is in trouble. Not this one. Hold on, let me actually take a look. Who is... Somebody is... Is it her? Come on. Jenna Lee. What happened to Jenna Lee? Oh, she's got necrosis. Yeah, I know that, but no worries. We don't have to worry about that right now. Let's just go to Barbara Garcia. You got fatigue, that's all. And that's 16 pages of 6 each, so we can have anything. Let's do a physical, speech listening. Let's do a chest auscultation and maybe a temperature. There you go. Jane Lee, what do you have? No, this is the one. You need some debridement for sure, very quickly. And I think you can actually directly treat her already because physical, she's done. Blood test, she didn't, but doesn't matter. Yeah, pretty much that's it. So all you have to do, Jane Green, we don't have anybody in traumatology, so I'm gonna just simply tell Jane Green to handle her as she wishes. Now, apparently she doesn't want to give everything else. I have to. Muscle pain, you're gonna need some NSAIDs. Pain, you definitely need some pain medicine. Necrosis, you're already getting the debridement. I mean, that's the first thing that she has to do. I agree with that. Dark skin. You can actually here, you can give some protective dressing. Fine. And burn management. It's not even anywhere. No, it's a microwave burn, so you have to give some burn management. So yeah, I'm basically telling her what to do, everything, and then just go home. That's fine. Judy Walker. You got asthma. Okay, asthma is not a nice thing to have, but at least we know that that's what you've got. Chest auscultation would give you bronchodilators. Let's do a physical first, but do you need even a physical? It doesn't have a physical either, you know? So let's do a chest auscultation. Oh, we did already. Okay. You don't need those. We need a thorax percussion. We did that too, so no need. Speech listening, we did. So basically we just have to treat this one, the asthma. So we just simply give you Thomas Lee is going to give you everything, and that's it. Okay, look at that. The surgery is done apparently. Is there enough free nurses to transport the patient? Which one? Okay, let's actually take a look quickly. In general surgery, are we like critical? Yeah, nurses station critical. So we do need some nurses here. I actually found it out yesterday. So yes, let's get some nurses in this department here. So we have one nurse. This is already a doctor. Only 2 nurses here. That's not enough. No, 3 nurses. Let's get another nurse here. Hopefully that's just gonna be enough. Um, Sorry about that, Susan Cole. I apologize, but you're in good place. I mean, she's right now in the ICU section, so she should be like fine. 00. Okay, this person is a night owl. That's annoying because, yeah, I mean, she's cheap but not so good. Oh, this one is good. She has receptionist. That's not. 160. At least he's cheap. And you know what? Maybe we can actually change his. Let's actually change his specialty, okay? We don't want receptionist. We want wait. What's going on here? What's going on? Yeah, we don't want that. Medical surgeon. You know what? I'm gonna need another medical surgery team anyway. So I'm gonna have him with medical surgery. He's not gonna get, anything right now. She should do the patient transfer right now. That's the most important thing. Okay. All right. So now, hold on. I just close it before looking at it. It still says, let's see if I go. It still says critical. Same thing here. This guy is also. Oh, yeah. He has to go over as well to get the odometry, right? So, we might need even more people here. Okay, let me hire 2 people here in the general surgery department. 2 nurses. Okay. Let's see. You have dirty feet. You cannot come here. Sorry. You are slow. Uh, yeah, you know what? You're gonna be my next bet. Alright. Alright, you should be fine. Okay. So she's just waiting. Now, Peter Allen, that's the next patient we actually have to treat. But let's go back to our, hold on. Our surgery is going on still here, right? I mean, they already patched her up. She's already closed back up. So her surgery is technically over, I believe. Let's see what you have. Peter Allen. She has blurred vision. That's all. It looks like almost certainly neurology department, but we don't know. We definitely do a physical first. Let's do. I think I'm going to do. Does he have any fever possibilities? What is that? Physical. I think I'm gonna do an ophthalmoscopy. I'm pretty sure that ophthalmoscopy is one of these things here. Tonometry, angio. Yeah, I mean. Yeah, let's do an ophthalmoscopy. Let's check her eye, basically. Let's check his eye, sorry. And we can do it here, no worries. Let's actually check if he has any other problem. Let's do a chest auscultation. Okay, and let's... Okay, for now this one is Dana Harris is actually my doctor, my control doctor, but for now I think, you know, we don't know if we're gonna even treat this person like, I don't know. Now this one's sunburn, it has to go to traumatology, unfortunately. So James Gonzalez, don't worry about this one because he's going over to traumatology where we actually have to do a physical, speech listening, and I think that's it. Yep, that's it. All right. Now let's actually go back just a second. Jane Taylor, are you already transported? Let me take a look because she's been complaining that nobody's taking her. Let's actually see. Are they still saying critical? Still saying critical. I'm sorry, you shouldn't be critical right now. I already gave you 2 more nurses. So, like, really, like, shut up. You see, I have so many people already working here. That should be enough for you. Okay, so that's all right. Jessica Foster. Okay, let's go back and I want to keep. Okay, hold on. By the way, let me see if the other. Okay, let me see. This one, Carol Martin, he's still waiting for the surgical team, of course, because they are just finishing it up, and when they fully finished up, then they can actually deal with her, so that makes sense. No worries. Jessica Foster, let's go back, I think. Let's see when they're gonna finally clean that place up. Okay, she's still there. They are still probably kind of like waking her up and everything at this moment. All right. What do you have? Jessica Foster, waiting for player. Okay. Nausea, weight loss, vomiting. We did all the simple stuff. Nothing showed up. At least now we are 100% sure that it's general surgery because we don't have an inspection department. Let's actually see what can we do. Let's do a... Yeah. I Gastroscopy is a bit drastic, to be honest. It's still the morning, so actually we have time to do various things. Let's see, what do you have? Gastroscopies. It's really unpleasant, but actually could be a good idea. Because gastroscopy here, stool analysis. Yeah, I'm sorry, you need to do a gastroscopy. It's a high discomforting. She's not going to be happy, but you can simply do it. You can do it simply here in the office or the diagnostic place, so you don't have to go into the hospital. You don't have to be hospitalized. A procedure where a flexible tube endoscopy, the tiny video camera and the light source at the end is inserted through the mouth in order to examine the upper part of digestive tract. Ugh, it's horrible. Anyway, you're gonna get that. Sorry. Not enough stretchers. Okay, now here is what I'm gonna do then. How much is it to open up another? Okay, I can do 2 things. I can buy some more stretchers. Okay, let's go here. Here. Let's see, that's the nurse. And where can we put the stretchers? Where can I put some more stretchers? Maybe here? They are complaining that there is not enough stretchers. Let's buy them some stretchers. Not operating table, just stretcher. There you go. I'm gonna put one here. Actually, let's put it one. I'm gonna put one right here. No, it's here. Actually, it's okay here. Okay, and one here. Don't cover the place. There you go. Are you okay now? Please tell me you're happy now. You got the stretchers, right? Fraser Thomas. Okay, that person is already, I think the surgery is over, so we are fine. Let's just go and see where we are. This guy had some temperature measurement, and it turns out he does have fever. Physical and chest didn't show anything. Let's see what we can do. Hey, Sunny. Let's do a CRP, because that's actually a quick check for if you have any elevated CRP levels. These two would be. I want to do something that is actually quick. A blood test is not quick. A CT would be quick, but I don't want to do it right now. Abdominal. We haven't done abdominal palpation, right? Let's do that. Abdominal palpation and that. We already did chest auscultation. Alright, let's just do these two for now. Linda Davis. Actually, let's go there. Oh, she has a chronic fatigue. We already checked that. And speech listening and oral cavity didn't show anything. Speech listening did. So I think we did everything here already. So it's time to just simply treat her. Karen Hernandez is not our doctor, is he? No, he is. Her sister, Elizabeth Hernandez, is. I mean, I'm just assuming. So you just simply gonna be treated as you are. Perfect. Kate Walker, however, is Elizabeth White's doctor, patient, but she has actually myocarditis, which needs IV antibiotics. Now she needs ECG. She needs which she doesn't need MRI, but she needs an ECG. Physical, she did. Chest auscultation, she did. So, out of all those possibilities, there were a lot. She has myocarditis. Let's see how many people are in the heart department right now. The nurse's station is still critical. I really don't get it. Let's go for cardiology. We have 3 patients here. One is examined, one is waiting, one is going to the receptionist. She actually... Sunny! Get out of here. No? Go ask Mama. Papa is not gonna help you with that. Mama is gonna help you. Alright, we have... Sorry guys, she would have... This one is an IV, so she needs to go to basically the hospital. She cannot do it just outpatient. So, let's go to the cardiology. You're gonna have a regular hospitalization. And then you're gonna go do an ECG. Okay, let's do an ECG. Sorry guys, I apologize. And We're gonna go and okay. Paul Hill, on the other hand, he has blepharitis. She just needs antibiotic ointment. That's an easy one. At least she's in the right department, and this is our doctor. That's awesome. Now, she would need tonometry would give her eye drops, him eye drops. He already getting the eye drops. He is getting the antibiotic ointment in a second, so no need for that. And basic visual test would also give him just eye drops, but he already did that. So let's just give him the eye drops, recommendations, and pretty much, oh, we're gonna give him the pain medicine. Definitely give him the antibiotic ointment because that's what is actually curing him, right? So I think everything is good. You can go on. There you go. David Jones. Angina pectoris. Pectoris. Okay, that is definitely cardiology. Unfortunately. Now, I don't know if that nitrates can be done like outpatient or you have to be in the hospital. I'm really not sure. But one thing is for sure, this person, he has to go to the cardiology. In cardiology, we actually have Daniel Jones, I believe, is our doctor. Yes. Okay. So he's going to go over to Daniel Jones. And what we're going to have to do is we're going to actually have to do an ECG. We don't need an angiography because we already... Oh, wait. Yeah, that would give him that... We have to give him the nitrates, right? So we don't need that. Let's see. Physical, he already did. Chest, we did. CRP, we haven't. So let's do a CRP testing. Blood test would give him some diet modification. Very low, so I'm not going to care about it. Yeah, so we're just going to give him an ECG. So we're going to give him a CRP and an ECG. A CRP is just checking some elevated CRP levels, just shows if you have some inflammation or not. And the ECG, or actually they call it EKG, that's how I know it, is just checking your heartbeat patterns and everything. So that's good. So that's it for now. Go. Margaret Garcia, she already had interview. Now, typical thing, James Gonzalez, you have 1% of differential. Let's see if you can do it. Physical and differential. Most likely it's not going to be good enough for you, but let's see. Because the standard way you can actually figure out what is happening, you go physical and differential diagnosis is going to actually normally determine which one is the one. So that should be okay. Go. Sarah Jackson. She has finished a fast. Did it show anything? Nothing. Look at that. 4 pages full and we still don't know what your problem is. That's getting a little bit upsetting. Let's see what we did. We did the easy stuff. We did CBC, blood pressure, serologic. We did the ECG, microbiome, serologic, PCR, USG, FAST, CT. We did all kind of things. We already did all of them. So I'm kind of getting a little bit lost. Let's go actually here because this is probably going to be quicker to figure out what to do with it. Echo. Did you do an echo yet? You didn't do an echo. Is there any reason why I should do an echo? Possibly. I mean, there are 12 pages of stuff. Blood pressure, obviously we did, right? I mean, that's one of the earlier ones that we always do. Wait, we didn't do blood pressure? Hold on. Oh, we did. Yeah, okay. We did serologic, we did CBC. We have done everything. Come on. Mm, I don't think we have done echo. What is this? There was one weird sign here. What is this? I never seen that. ELISA testing. Ah, can we even do ELISA testing? I'm not sure. Yeah, we can. Okay, let's try first just logically. Okay, you have nausea. Um, I would do. Do you need a nasal cavity somewhere? Can I see a nose somewhere? I'm not gonna go everything one by one, but doesn't look like it. Pulse oximetry, heart monitoring. Okay, we haven't even done just a normal blood draw. Let's do that. Uh, we have done, so many different things that are possible. CT. We haven't done a CT. Oh, we did a CT. Look at that. We even did a CT. Yeah, the ELISA testing is something that I think we should. Let's do an ELISA testing. Um, Allostate test sampling. This is about the pancreas. I'm not sure if that's necessary. This person is a heart case. I'm gonna be really happy if I find out what's wrong with her. Stool collecting. Okay, so do an ELISA testing. Barium swallow would also gonna have that. These are all not really pleasant things, but so far he's okay. He's not so unhappy. I mean, he's not too happy, but he's not so uncomfortable. So sometimes the happiness and the level of comfort are separate. So we'll see. Go to Susan Robinson. Okay, you are already totally set, and this is my doctor. Perfect. Elizabeth Hernandez. You just give her saline nasal spray. You're gonna give him any of these needed? Yeah, just the fever medicine. Good, thank you. Patricia Thomas, you have an ACL injury. Anything else that we don't know about it? We do a physical for you, and we can figure out most of it, I believe. Yep, let's just do a physical and take it from there. Jessica Foster, you had an esophagitis. You just need antivirals, but let's see. At least you are in the right department. That's a good thing. Um, let's see. You got thorax percussion. We've done. Neck palpation. We've done. Barium swallow. We haven't. So this one was the one that we gave gastroscopy because there were so many different things. There were like 6 different possibilities or 8. So now it's very clear that that's your problem. However, that would only give him some diet modifications, and she already got that, so no need. Antacids. Okay, the physical would have shown that. We checked the temperature, so everything is done already. So I'm just gonna ask him to pretty much just handle her. There you go, Jessica Foster. Yeah, I just did that. Wait, what was the other one? Patricia Thomas, we already did it. We dealt with that, right? Yeah, we did. And Jessica Foster, go to, that's where we are, and we already give you, basically, gave it to Young. Okay, and then Okay, I already told you. Yeah, so I don't get it. So why isn't he getting the... Okay, let's give him the antivirus. Okay, I'm gonna do it for him. He's lazy. Low, medium, so I need that stomatics. And that's it. Okay, Fraser Johnson, what do you need? You definitely have this problem. Okay, we can be absolutely sure. But I'm still gonna need a physical and a temperature. Yeah, let's do that. Fraser Thomas, you got finished the abdominal palpation, showed nothing. Okay, we haven't done a lot of things, so we are fine. We did a CRP, no elevated CRP here. So supposedly not these two, but you never know actually. That's the problem. So physical, it's all physical. Interview, a blood test would give some, and MRI. I don't want to do an MRI yet, if not necessary, but that's a possibility that I'm gonna do. Which one is better, if I do a CT or an MRI? Let's see, if blood test, I think I'm gonna do a blood test. But actually the problem with the blood test is it takes much longer. So a CT or an MRI would be much quicker directed to the problem that he has, you know? So that's why I prefer a CT or an MRI. An echo and ECG could be also working. Okay, so let's go one by one. Let's actually do an MRI. Or ECG or MRI. Or an echo. Where do you do the echo? Hold on. Echo. Oh, you cannot do an echo here. Okay, can you do an ECG? Of course you can do an ECG. Or let's do an MRI. Because I haven't sent anybody into the MRI for a long time, so I'm pretty sure that that one is empty. And he can do, or you know what? Let's schedule both of them. No, let's just do an MRI, because if he is not having a cardiology issue, he is not going to have that anyway. Peter Allen. He's got some kind of neurology problem for sure. So why don't you, sir, go over to neurology and talk to Nancy Calder. Okay, let's start with that. And then we're gonna do some neurology testing. We have done already some physical and ophthalmoscopy, so that's fine. Let's do a jonioscopy, I think. Yes, let's do a jonioscopy because that's in the office. You don't have to go anywhere. And we take it from there. All right. Let's quickly take a look at something. Where is the... I'm just clicking on somebody just to see. Carol Martin is still scheduled for the abdominal surgery. Let's take a look if the surgery is going to take place anytime soon. Okay, so this guy is already gone. Wait. No, this guy is she's still there. She's still there. She's finished already. Hospitalized after treatment. She's waiting with patient. I think they need the stretchers. So where are... I already got some more stretchers, right? Let's go down again. Let's go here. Okay, I'm gonna actually buy 2 more stretchers. Oh, they already have. Okay, you know what? Maybe I just move this. Move it here. Okay, I cannot move this one because this one is in use, I believe. Okay, no problem. Somebody is already using this. So they are still working on that. Okay, no problem. Anyway, guys, I think that's gonna be it today. I think we've done well enough. It's only 10:29 in the morning here, so let's take a look. First of all, we have a prestige is going very well. It's 98%. We are all happy everywhere. The pathology department people are not happy, maybe because they are bored. There are no dead people. I apologize for that. We do have we are making some nice money so far, and I'm actually thinking it's only 10:29. Maybe I should give back some of the loan. Not yet. I think I'm gonna wait for that because at any time we might have to have some extra costs. So I think I'm gonna be careful with that. Although one less 20,000 block means 200 NTs, which is paying for one nurse or one uh, janitor or whatever, not necessarily a doctor. So yeah, that's all right. Okay, guys. So that's where we are finishing it. And if you like what you see, please hit the like button, hit the subscribe button if you haven't subscribed yet. And at the same time, this is the 31st of December here. So if you see it still today, very happy new year to you. Even if you see it in the next couple of days, it's still valid. So very happy new year to you guys. I hope that 2022 is going to be much better for everybody, the whole world actually. I'm certainly excited for it. And don't forget to check out my other videos. Also, for example, my medieval building, village building program, Ostriv, that I'm gonna play sometimes. And I think this is gonna be my last stream in this year. Tomorrow is gonna be the new year, so I think tomorrow morning is gonna be my first stream this year. I mean, next year. All right. Thank you so much again, and I see you guys very soon. Bye bye.